Hi, again, this is Dr. Ellithorpe, and we're doing this weekly live Ask the Doctor, Integrative Doctor, and we're doing this for our clinic for many reasons. Oftentimes, patients come to an integrative or functional medicine doctor, and they'll have many questions, many problems. Some come just for preventative health. So we are dealing with patients who are presenting their whole being, spirit, soul, and body. And when we begin with our patients, all of us 5 clinicians here at Tustin Longevity Center, we're looking to try and get a fix in our first visit with you. We spend an hour, and we'll go over in great detail your background history, where you've been, what kind of world travel, what kind of stresses you've had growing up. Many things about your background do implicate a trend that we see toward disease. And one of the first places we start as a functional medicine clinic is in dealing with gut health issues. Because we'll tell our patients the world comes at us largely through our mouth, what we're eating. And in that food is going to be, of course, what you repair yourself with and grow with all your life. If you are raised on a diet like the standard American diet, which is full of processed foods, high refined carbohydrates, instead of plenty of water, always juices and apple juices as a kid, carbohydrate goldfishies and treats, then you're going to have a building block that is probably not optimal for your growth and your immune system and every part of your health. So today, I wanted to bring up as a maybe a template what items we begin and what our instructions are for gut health. Now, this is not the whole thing. Again, we're only here 20-30 minutes at most, and I'm in between patients doing this. So what we begin with is we ask patients to understand that we really aren't designed to be eating all day long. We think it's marketing, this concept of eating 3 meals or more a day. When I was young, back in the 1950s, basically, at most, people would eat 3 times a day. It evolved through marketing into eating 3 to 6 times a day and healthy snacks, allegedly. We think this is marketing. I think if you look at history of mankind, being able to eat a meal or 2 a day that's good or decent or sufficient was a wonderful thing. This concept that we need to eat frequently, I disagree with. Your gut itself is a, so to say, a machine that needs its time to rest also. So if you're constantly putting food down your throat, into your stomach sac, whether or not you're digesting it well enough, as you know, last time I talked about blood type A, I find as a clinician over 40 years that the A-type blood people just don't digest food as well, and they need digestive support. So you put food in your sac here, it's supposed to be digested, and then the pylorus is supposed to open, go into the small intestine, and there it's supposed to be processed and take the good, leave the bad, and you're to expel this. Well, I'm getting patients who, are having a bowel movement maybe once every 3 days, 5 days, and they think that's normal. So when we do our physicals and histories, we're very detailed, and we ask, even in your childhood, if you tended to have constipation or tummy aches or issues like that, among many other things we ask. So we begin by saying about your diet, and some of the items that we use is food restricting times. For instance, there's a term called intermittent fasting, where we ask our patients to try and narrow their eating into a 6 to 8 hour window, maybe noon to 6 p.m. We definitely tell all our patients not to eat late. There are many biochemical reasons why eating late, if you fill your stomach up with food at 7, 8, 9 o'clock, you are biochemically telling your brain information that is basically telling you that you're supposed to be using your body for another, 6 to 8 hours instead of going to bed soon. So we don't want any of our patients eating late. lot of our patients have trouble sleeping at night, and one of the big causes is you eat too late at night, because those are stimulating chemicals from your digestion as food is trying to be processed later at night, confusing your body that knows, according to the Earth's time and cycle with the sun, that you're supposed to be going to bed, but now you're sending in food information to your brain to say you want to use your body, allegedly, and you just fed it food to help it do the work you want it to do. We also ask to lower the carbohydrates. I've been doing this decades, long before the keto parade came along, and I agree with it. Long before Gary Taub's book came out, Good Carbs, Bad Carbs, we had always been here identifying the insulin problem, and we've always been checking insulin levels and things like this for decades. So your diet is where we begin. Some of the things we like to do with even my ulcerative colitis and my Crohn's patients is we ask them to make a little mixture of some of the SBI powder is just serum-derived immunoglobulins. This helps your gut have a immune system protection boost, so to say, boosting your immune system in your gut when it's worn out from all this years of abuse and damage. We mix it with a probiotic powder, so we make like this little cocktail. And then, since the lining of every cell membrane is made of fat and protein, phospholipids, we use the phospholipids that I've done a lot of research and publications on. So we mix this fat phospholipid with serum-derived immunoglobulins, and we mix it with probiotics. I'm sorry, this one here is the probiotic, this one is the fat, and this one is the serum immunoglobulins. And then I'll talk to them and ask them to put a little squirt of the only human essential fatty acid is linoleic acid. It's not fish oil, it's not EPA and DHA. With linoleic acid, you can make all the EPA and DHA your body needs, and it doesn't need a lot. Linoleic is essential for life. It is a item in the essential fatty acids that without which you will get sick and very likely have the risk of dying. So linoleic acid, it comes from eating animal products, meat, egg yolks and things, and these have been shunned all these years foolishly by the poor dietary advice of our guidelines that come out every 5 years. So I've never followed them. They've always been wrong. So here is the essential fatty acid, linoleic acid, which makes up the lining of your cell membrane with this fat, with these probiotics and these immunoglobulins. I've almost never had a patient with Crohn's or with ulcerative colitis or irritable bowel that didn't improve immediately. So these are time-proven, clinically researched materials that we use here. The next thing is we ask anybody who's a blood type A to use orthodigestzyme to help them with their digestive enzymes and betaine hydrochloric acid to break down properly their protein digestion and fat digestion so they have healthy presentation to the gut, the small intestine for absorption, rather than inferior digestion and weird looking poorly digested molecules frightening your immune system. We also tell people who are just getting older. I'm a B type blood, B positive, and I've been using orthodigestion I think since I was about 55. I'm about 66 now, and I've been using this, and I really saw the need for it as I aged. All people make less digestive enzymes, so I use this with my meals. There is, once they finish and have improvement, I use another product called mucosagen. It kind of is a condensation of many of these wonderful products. This has in it gut calming items in it as well. I won't belabor the point, but we like to explain to our patients, mucosagen will have the L-glutamine powder. Although we do have L-glutamine separately, some people don't have such a bad gut that they need all these products to heal a injured lining. Maybe they just have intermittent irritable bowel symptoms, gas, bloating, and discomfort occasionally, for which if they just took the amino acid L-glutamine in a powdered form once, twice, 3 times a day whenever they get heartburn, this will solve it alone. But inside of this mucosagen is that L-glutamine, vitamin A, which is important, biotin, zinc. It has N-acetyl cysteine in it. It has lactoferrin, and many other wonderful things that in one capsule is quite beneficial for gut health. So those are a few of the items that we do use. And we recommend water. Water is one of the things, when you come to our clinic, there is a patient log to fill out, where one of the first things we ask is, how much water do you drink every day? The second thing we ask is, are you exercising? How is your sleep? How is your energy? Are you trying to eat a lower carb diet? Are you trying, and many times we find lectins of the food irritate your bowel and inflame your gut and lead to irritable bowel. So we study food allergies, or if they don't do the food allergy test, Immunofood is the one I use. It's the one that has the longest history of accuracy that's done in Fort Lauderdale, Florida. That test looks at your reactivity. You're actually making antibodies to foods that you eat. And if you get in a pattern, and remember, marketing in America is all about getting you to buy the same thing over and over and over again and eat the same thing over and over again, which increases your odds of exposure of that same food construct, the protein nature in it, the lectins in it. So let's say you're eating corn every day in the form of corn flakes or corn tortillas or corn itself or corn bread, corn. I guarantee you that you will have developed immunoglobulins to corn, so that eventually as you eat the corn, you'll start feeling more ill. Your gut will start having explosions, you might say, on the immune system lining the gut, because 80% of your immune system lines the gut from your adenoids all the way through. So we teach patients to rotate their diet, to try and have a menu one day that's totally different from the next 3 days, okay? And every fourth day you can come back to corn, say, allegedly, or wheat. Wheat has been genetically modified, so we ask them to avoid the grains, the legumes, and dairy initially, usually on our first appointments. And lastly, we'll be asking them how their sleep is. Every time you come and see us, we're going over all these things, because everything does matter. The amount of exercise you do, the time you go to sleep, the time you eat, what you're eating, how many carbs are in it, are you eating the same thing over and over and over? And so we're looking at this with you. And fortunately, over the past 20 years I've been at this location, we have had wonderful, wonderful results. So I guess that's the template. So if there's any questions, Blake, go ahead and let me know.
Yeah, we don't have any questions directly related to that, but we do have a couple questions. One says, I was a patient at your amazing center when I lived in California, and I've been searching for a doctor as great as you for a long time in New York City to no avail. Would you have any colleagues to recommend in the area?
I went to Capital University of Integrative Medicine to get a second doctorate in Washington, D.C., and Dr. Ali, A-L-I, Mujid, I think was his first name, A-L-I, and he's written many, many books about natural medicine. He's in New York, A-L-I. If you go to the American College for the Advancement of Medicine, ACAM, ACAM.org. I was on the board of ACAM. They teach basically chelation therapy and many other wonderful natural things. ACAM is probably the first foundational organization to get and attract doctors to do basic, natural, healthy things first. Chelation was one of them. And they were formed in 1972. And if you do acam.org, there'll be a search engine there that'll say, what is your zip code, where's your area, and find a physician near you. So you could go to acam.org, and I'm sure there's a member of that organization that's in the New York area where you're from, and hopefully that'll be a help to you.
And it's important to remember that we also do telephone consults for someone that would still like to visit with you.
That's right. If we've seen you once and have your exam and your history here, very often patients who move or leave, we can do phone consults with you over the phone and hopefully see you when you're in the area. Oftentimes, many people do come through here. We're fortunate to be in Southern California where so many people vacation. And so that would be another option for you.
Great. And we have one more question, and that is, what is your recommendation for proper exercise and muscle tissue recovery? Are your vascular enzymes good for this?
All right, so inactivity is a plague on the American lifestyle right now, especially with the computer world putting us into a bent over, thumb behavioralism and nighttime watching TV. You can do all the sociological studies on the hours that our kids and we are sitting in front of screens. Activity is quite necessary. The recommendation we give, basically, I'll tell my patients, do you brush your teeth every day? And they'll say, of course I do. I do it twice a day. And then I say, well, then only brush your teeth as often as you exercise. And they'll go, well, I only exercise once or twice a week, if that. Then I say, only brush your teeth once or twice a week, if that. And what I'm trying to do is sarcastically let them see they've placed value into brushing their teeth. And of course, I believe in brushing your teeth. But even more, just on a side, because, integrative, it's hard not to avoid a rabbit trail. Vitamin K2, which is in our vitamin D K2, helps prevent cavities. We use the fruit, vegetable, and berry mixture Juice Plus, which has periodontal enhancement for that. Nevertheless, if I forget to brush my teeth, you know how you feel a fuzz over your teeth in the morning, then you need to brush them? Ever since I've been using vitamin K2 with my Juice Plus, I don't have that morning fuzz. And then if you look at archaeological studies of peoples who had naturally the animal-based product, vitamin K2, you'll see their skeletons will have all their teeth in it. But in the countries that archaeologically did not consume the meat product, vitamin K2, or the animal product rather, they had terrible teeth health. Now, I was saying that about exercise. So there you are. I say, if you don't brush your teeth, but twice a week, then exercise twice a week. If you brush your teeth every day, exercise every day. Now, we need resistance training and we need aerobic training. So we have two dimensions. I know there's more, and I'm not a specialist in sports physiology, although there are 7, I think at least 5 research studies on the sports physiology of the Juice Plus that we do recommend in our clinic. We want to see you do resistance training. I personally use what is called the Perfect Workout. It is an organization that has a personal trainer with weight machines, and you go in there at least 20 minutes twice a week, and you do very slow repetitions at a peak weight. And so I do that, but I do, in addition, other rapid, lighter weight workouts. I'm doing about 5 to 6 days, but then I also try and speed walk 3 miles at least 4 times a week. So you need the aerobic, you need the resistance training, but you also need the water to do this. And you need enzymes. Enzymes, Vascuzyme will help with the inflammatory debris, because when you use your body, at nighttime you're supposed to heal and repair, and you have to have capillaries that will bring the repair material to the tiniest cells in your body. So you see, it's all a web matrix, and that's what you want in a good functional doctor, is to understand the multidimensional aspect of it. Are you drinking enough water? Are you exercising? What time do you go to sleep? How late do you eat? How many sticky, clogging carbohydrate fruit sugars are in there? Are you taking enzymes? And are you trying to, do your resistance training as well as your cardio aerobic training? And I would say every day should be done. Every day should be done. But I have to confess, I'm only maybe doing it 5 to 6 times a week.
Great. We had another question come in. It is, what supplements, diet, and lifestyle practices do you recommend for a sufferer of chronic fatigue syndrome, a 29-year-old female, and how to overcome that?
Well, yes. So the multi-dimensional approach has to be done here. One is water. You cannot downgrade the value of water. And I just see, I've been doing this almost 40 years, and I see I'm here all the time. I really never take vacations. And I'm working all the time seeing people. And I would say it's the rare patient that is coming to me and says that they drink half their weight in pounds as ounces of water per day. So if you're a 200-pound man if he tells me clearly, I know I'm drinking 100 ounces a day, half his weight in pounds. Just drinking enough water every day is very beneficial for any pain problem whatsoever. Now, if you don't have good tiny capillaries, if you've clogged them up with a high carb diet, or you have food allergies unbeknownst to you maybe, and you have those little immunoglobulin complexes with sticky sugars clogging up the capillaries, then you're going to be sore everywhere, because the more peripheral the blood vessels go, the capillaries, the more distal you're going to have these little dead cells that don't get the relief of the nutrition and waste removal that those capillaries would do. So we use enzymes, systemic enzymes, and they are taken on an empty stomach. So every morning I use VitalZyme. I'll take 6 enzymes in the morning on an empty stomach, and I use VitalZyme because it does have serrapeptase in it. And that will also disinflame the body, i.e. pain. But then also, if you've been eating a poor diet all your life, not due to you necessarily, I was blessed to have a father in food research. So my diet was watched over like a hawk. I can remember my dad scooping in out of brown jars B vitamin powders and calcium and other things on our breakfast food every morning. So I've had a wonderful diet throughout my life. But if your diet has been full of sticky carbs, repetitious patterns of eating, food allergies, lack of water, then you're going to have the breakdown there, and your cells that are constructed, the membranes themselves, are a double layer. They are a double layer of phospholipids, which are fats. And then there's the protein receptors in it. So your cell membranes are made of phospholipids and proteins and cholesterol, and we love cholesterol. So if your cell structure does not get, because you've been listening to the poor advice of your supposed not knowledgeable medical authorities on the dietary advice every 5 years to avoid saturated fats like cholesterol and eggs. And now when I say beef, when I talk about beef on these series, or fish or chicken or any of these meats, I'm talking about all grass-fed raised material, okay? So because I also disagree that meat that is in these slaughterhouses and such that my father was involved with and fought against in the 50s and 60s when I was a little girl, they're clearly lousy methods of raising healthy meat. But the grass-fed ones, if you do a biopsy of their tissues, the fatty acid composition, omega-6 or omega-3 ratios compared to a stockyard raised, abused, grain-fed, antibiotic, steroid, puffed up poor cow is a totally different biochemical structure than the healthy guy. And you could look at a healthy, lean man who's eating well and muscular and cut. And then you look at a poor guy who's had the bad example and just gets fat, pappy breasts and belly and beer. If you do a biopsy of him, he'll be bad like the cow that was abused versus the grass-fed cow. So your cell membranes may have been damaged. And so we are very aggressive in giving phospholipids. And that's why I did research. If you go on our line, tlcdoctors.com, and you look at research publications, I've published on repairing the cell membrane. These phospholipids, which naturally are in egg yolks, naturally are in healthy meats, naturally are in healthy fish and poultry and such that we've been scared away from eating, these fats repair the membrane, which help the energy content and the inside activities of the cells perform better, produce more ATP, and you have more energy. So repairing cell membranes is another critical factor in these chronic fatigues and fibromyalgic scenarios. The other thing is hormones. Usually there's so much stress in young women today that cortisol dominance will stop follicle stimulating hormone signals to the girl's ovaries, and you won't ovulate every month. So then you'll become hormone imbalance, you'll be estrogen dominant. That adds to inflammation if you don't have a nice monthly cycle like God planned for, with ovulating, producing progesterone for 2 weeks roughly, putting a control on the growth promotion of estradiol, And then, of course, your diet has to be lower in carbohydrates, and give your gut a rest. Try and limit the time that you eat, and you use this gut system for you. Keep it to a 6-hour framework, and try and only eat 2 meals. Those would be our beginning advices to you. Enzymes, then, of course, I would do a SpectraCell. I've been working with that company for about 30 years. They'll give me special deficiencies like magnesium, vitamin A, vitamin C, CoQ10, glutathione, and these kind of things. And you may have some severe deficiencies that are critical because you've had poor cell membrane from your poor diet and your poor exercise and your poor water and the lack of enzymes and the food allergy immune complexes. So we walk you through this, and I think that's why we're very successful, because I'll see maybe 6 to at most 10 people in a day, and we spend time with you. Our aim is not to see 40 people and rack up insurance bills. Our goal is to see our patients do well. I'd rather be wealthy and healthy patients than be personally wealthy. And I'm only average in my income as a doctor, but I'm certainly blessed with a ton of patients who love me. Any other questions?
That's all we have.
So we're about at that time. So we'll be here weekly. We do this now every Wednesday at 9:45 in the morning. And now I'm going to go back to my patients. We are going to possibly have our other clinicians. We have 5 clinicians here, and they might be taking up a 2 times a week. So you can kind of come in and give us your questions in the chat. I want to point out, when I talked to you last week about enzymes, if you are on anticoagulant therapy like Coumadin, warfarin, aspirin therapy, Plavix, things like that, we want to tell you that our aim is to try and transition you off of those onto natural enzymes, which are natural anticoagulants and keep the blood thin. But those people who are ill enough to have to be on constant anticoagulant therapy, I forgot to mention last week that we do want you to be cautious with systemic enzyme therapy. You should have a doctor like us who can help make that transition for you. And I do this all the time. I have tons of patients on Coumadin and Plavix and warfarin, all these things, and aspirin. Not to worry about a baby aspirin, but if you're on multiple ones and have chronic medical problems, let us help you with that. And at that, I want to thank you, and I hope to see you next week at 9:45 every Wednesday morning.